everybody. This is Rosalind again today. I'm disclaiming that I'm not here representing my employer or International Diabetes Federation or Diabetes Canada or any association. I am here for Diabetes College Let's Diabetes, an information session only for all of us to get to know how to tackle or to beat diabetes. So, in this episode, we're going to be talking about the classical signs and symptoms of type 1 and type 2. They are very similar, but in type 2, there's a wee bit of more to it. I'm going to go by the way International Diabetes Federation explains of diabetes. That is not because there are various differences, but because they cut across all nations, so they cannot take into consideration a couple of things that might not be existing in all the countries. So going by them, I will say type 1 diabetes signs and symptoms. The first thing we tend to experience is abnormal thirst and dry mouth. And the second thing is frequent urination. So I'll just explain why this happens. And abnormal thirst, for you to be when you have a lot of sugar in your system, remember the body's not able to get rid of this sugar. And then the only way the body will get rid of this sugar is by urinating. So the part of your body called the kidney will work extra hard to get rid of that sugar. And the way you feel it is by peeing. You go to urinate a lot. And so the more you are urinating, the more the body is wanting to replace that water because you will get dehydrated. So you drink and you pee. Those are the classical symptoms of actually all diabetes. So this is for number 1 and number 2 of type 1 diabetes. And then you lack energy and fatigue. Of course, if you remember the previous episode where I said that when you eat your food and the sugar is not absorbed or converted to energy, you will lack energy. So it's all hanging around in the blood and there is no insulin to actually take it where it will be utilized for energy. So that way you will lack energy and you'll be very, very tired and you will have constant hunger. And of course you will lose weight, because what tends to happen in type 1 is when there is no way the body can make use of sugar because there's no insulin, the brain will go into plan B of breaking down fats to utilize as energy. With that, you end up losing weight. That is a very unhealthy way to lose weight if the body is breaking down the stored fat, to convert it to energy, especially in type 1s. So just bear that in mind. And then bedwetting. This is one thing I like the fact that International Diabetes Federation added to that. So with bedwetting, what tends to happen is you see a child who has actually outgrown bedwetting, they suddenly start bedwetting again. So you don't need to spank this child. You just need to find out, why is the child bedwetting? One of the things that'll come to mind is a test for diabetes to rule out the fact that the child is not a type 1 diabetic. I did mention in my previous episode the fact that type 1 is very common amongst young people. It does cut across all age group, but it's quite more predominant among the young people. And then there's also blood vision that occurs in type 1 diabetes. When you have excess sugar in your blood, it does affect your vision and you have a blurry vision. When the blood sugar is corrected, the vision kind of normalizes. Type 2. So in type 2, this is really one of the commonest type of diabetes. It does occur in about 90% of people with diabetes, the population with diabetes. Signs and symptoms still the same like type 1, excessive thirst and dry mouth, frequent and abundant urination, and also lack of energy and fatigue and extreme tiredness. So in type 2, if you remember, I did mention that most of the time you might have diabetes. If you do not test, you might not know you actually have diabetes. So it doesn't prevent the diabetes from causing some damages. So most of the time, the regular classical signs and symptoms with type 2 you have, in addition to the fact that the body has already started undergoing some damage, presenting themselves as also signs and symptoms. So for instance, you might have tingling sensation of the hands and feet. It could manifest in type 2 as signs and symptoms, might not manifest in type 1 because when you know type 1 is when it started, but type 2, when you know about it, is not exactly when it started. Then there's also a recurrent fungal infection with type 2 as signs and symptoms are the initial diagnosis. And there is also slow wound healing. Typically, when you know how long it takes for a cut to heal or a bed sore to heal, But in type, if you already have type 2, you find that that wound is taking such a long time to heal. And you probably have not been diagnosed with type 2, so you wouldn't even know why you're having slow wound healing. So that's why IDF has considered it as one of the signs and symptoms of type 2. There is also blood vision like in type 1, and there's also, if you live in a rural area, be it in a Western world or in a second world country, and you happen to go hunting or you go to the farm or even you go camping and you happen to pee in the bush, if you look at that pee where the area where you've peed, and suddenly ants start circling around your pee, then you should suspect diabetes, because what the ant is doing is actually wanting to lick the sugar contained in the pee. So these are the classical signs and symptoms of type 1 and type 2. They are very similar, but like I said, in type 2, there's a wee bit of more to it. So that would be it for today. And I need you to look out for the next episode, because we're really going to talk about more. Right. Till then, I would suggest that you up to date with all the episodes. All right, then, you take care, and I will see you in the next episode.